Welcome back. You're watching McLaren Port Huron's Today's Health, and I'm talking with board-certified obstetrician gynecologist Dr. Amanda Hurtubise, and we're talking about those midlife years and what are the health risks. So, Dr. Hurtubise, what kinds of things are you screening for then in those midlife years?
Sure. 50 tends to be a time when we're talking about increasing some screening tests for women, and they may be perimenopausal or menopausal at that point. So with my patients at their annual exam, we're of course doing a clinical breast exam as well as recommending mammography screening. We do recommend that on a yearly basis, starting at 50, and depending on who you talk to and a woman's risk, we may have been doing that since even age 40. We also recommend a pap smear, which is a screening test for cervical cancer. Many women have been doing that on a yearly or semi-yearly basis, and we recommend continuing that at this midlife point. We recommend screening for colon cancer at or around age 50. That's done by a colonoscopy. And we also look into that, what we talked about earlier, if a woman is having really heavy or irregular or problematic bleeding, we do want to rule out pathology or problems with, say, uterine cancer or even ovarian cancer. A good clinical pelvic exam is the best way to do that.
So these are all things. So what I'm hearing you say is it's important to see your physician every year.
Absolutely, absolutely.
During this period of time, which would be like 40 to 60?
Yes, I think so. And whether that's your gynecologist or whether that's your primary care physician, many of my patients will alternate. They'll see me one year and their primary care physician the next year. But the bottom line is somebody needs to lay hands on you. They need to get a good clinical breast exam, a good clinical pelvic exam, because really we can discover a lot if it's there on that simple exam.
Let's talk a little bit about the increased risk for heart disease and diabetes. Are those things you address?
I do talk with my patients about that and make sure that if we have a concern there, they see a good family practice doctor or internist. But as we age, due to genetics, due to lifestyle, oftentimes being over our ideal body weight, sometimes being sedentary, that increases women's risks of high blood pressure, high blood sugar, or even overt diabetes, high cholesterol, which set us up for some other health concerns down the road. So I do address that with my patients, make sure that we're talking about diet and exercise, family history, and make sure that if they need that screening with an internist, that we're getting that arranged for them.
How about bone loss or osteoporosis? Is that a risk also?
Well, certainly the early stages of bone loss, the foundation is being laid or removed, I guess you should say, for the bones in this middle age. As estrogen levels decrease, our calcium uptake into bones is less, so the bones start to lose their mass, which can translate into osteoporosis much farther on in our 70s and 80s. So I am talking to women in their 40s and 50s about weight-bearing exercises, calcium intake, vitamin D intake. Hormones, again, being deficient in estrogen or testosterone increases our risk of bone loss. So while many women in their 40s and 50s don't have overt bone loss or osteoporosis, the foundation is there. So we do address that.
So some of these risks are increased related to the decreasing hormones, and some of them are related to lifestyle and genetics catching up with us in this age?
Yes, that's why it's all of the above. So I encourage women to just talk about all of their symptoms, and again, being comfortable with your provider who is going to listen and get into that with you, because there are so many symptoms, some that are nothing and others that really could be a health issue or a concern.
Let's talk just for a minute about emotional health, because a number of those symptoms related to menopause, like you talked about moods and depression, and is that something you talk to women about and women are comfortable bringing up?
Absolutely. Like I tell my patients, what happens in the GYN room stays in the GYN room. It's usually a place where women should feel comfortable talking about this type of thing. Common mood symptoms or changes that women experience in perimenopause and menopause are irritability. Fine 1 minute, crying at that puppy chow commercial the next minute. Things that used to not bother you, finding that they might make you a little bit more angry. And that can be confounded by poor sleep. When we're feeling exhausted, when we're fatigued, we're not sleeping well, that makes our mood worse. Anxiety, feeling a little bit anxious in situations that didn't typically make you anxious. So we talk about, can this be a true clinical depression? Is there other things going on? And if those are all negative, life is good, then we say, okay, this may be your hormones. And that makes sense. Who doesn't have a teenager whose moods are all over the place? What do we say? Well, it's hormones. The perimenopausal transition, we have lots of up and downs of our hormones, and so it makes sense that that impacts our mood.
So these things that we're talking about, women should view them as possibly in the realm of normal, rather than saying there's something wrong with me, so I'm not going to
Right,
this.
right. And I also like to say, just because it's normal, great, there's nothing wrong with you, but it doesn't mean it's optimal. So I don't want people to think, well, it's normal, so therefore I must put up with it. It's normal, so therefore I must suffer through. Normal, I want my patients to be at optimal, and that's where we talk about what are our hormones doing? What is our diet doing? What is our exercise doing? Could we be doing some botanicals or some supplements to get you from just normal to optimal?
Great point. This has been such good information. Do you have closing comments?
Well, I really appreciate the opportunity to talk about this. I think as you sort of hit on, that sometimes we don't feel like we can bring it up, and I want to encourage women to find a provider that they're comfortable with talking about these issues, knowing that there are multiple safe, good hormonal replacement therapies options out there. It is no longer all hormones are bad. We've evolved from that. So encouraging women to talk about their symptoms, seek treatment, seek advice, and try to go from that normal to that optimal.
Thank you so much for joining us.
You're welcome. Thanks for having me. It was fun.
And thank you for joining us. You know, we've talked about a lot of things today. If you have questions, you can call us at Health Access. That's 1-800-228-1484. You know, you can go to our website. There's great information on our physicians. You can contact us. You can order a copy of this program, which I might even do myself. Great information here. We hope you join us again next week for Today's Health. Today's Health is brought to you by McLaren Port Huron.